started the timer and there is a question. Right. So if you have read and understood, considering it's surgical pathologist patient, kindly tell me, what are your differential diagnosis for this patient?
Considering the pain and the presentation, my differential diagnosis will be osteomyelitis,
Yes.
septic arthritis,
Yes.
osteoarthritis, or gouty arthritis.
Good. Okay. Can you tell me how would you confirm your diagnosis?
To confirm my diagnosis, firstly, I will go for knee joint aspiration.
Yes.
And send the fluid for cytology and culture sensitivity.
Yes.
Then I'll also do X-ray of the knee and X-ray of the knee joint.
Yes.
And then if needed, I'll also do some blood investigation, ma'am, to rule out.
All right. Okay. You said you'll send the aspiration of the knee for the culture. What are the most common organisms that cause these sort of infections?
We have the gram positive, commonly the Staph aureus. Then we have the Staph epidermidis. Then we have the streptococci, pneumonia and all. And we have the gram negative like Enterobacteriaceae. We have Pseudomonas haemophilus, Neisseria species. And also uncommonly, we have the fungal infection and mycobacteria.
Can you please tell me the pathogenesis behind this osteomyelitis? Sorry.
The pathogenesis initially begins with the microbial invasion.
Yes.
Of the bone, and which triggers an acute inflammation, whereby there is increased vascular congestion and there is fluid exudation with the infiltration of polymorphonuclear cells.
Yes.
Which increases the intraosseous pressure and causes pain. Then,
yes.
Then this infection will lead to formation of pus in the medulla, which will spread to the subperiosteal space through the Walkman's canal and forming subperiosteal abscess, causing subperiosteal elevation. Then in this continuing process, due to the raising intraosseous pressure, vascular stasis, and infective thrombosis, there's the part of the bone dies, forming the sequestrum. Then around the sequestrum, there's a new bone formation, which is called the involucrum, that takes around 10 to 14 days. Then if the infection is controlled, then it resolves. Otherwise, if it doesn't resolve, then there is formation of discharging sinus.
Can you please tell me how these microorganisms are transported, by which methods?
First thing, it could be hematogenous spread.
Yes.
To the site. Then it could be because of it could be from direct inoculation, like during trauma or fracture, or it could be from contiguous spread from the joint, like in case of septic arthritis and all.
Okay. Right. What should be the treatment or management that you can offer to this patient?
Treatment, it depends on the presentation and symptoms, ma'am. The treatment options will be initially, since it's an infective condition, I'll start broad spectrum antibiotics. Then covering both gram-negative and gram-positive and negative. And then the supportive treatment, I'll treat the pain and also splint the limb. And then if this conservative management doesn't help, then I'll go for surgical management, surgical drainage and sequestrectomy.
Yes. Right. Okay. Can you please tell me what is the mechanism, how this pus, which is formed inside the bone, it busts the bone and comes out?
Yes, ma'am.
How this pus or infection, which is formed inside the bone, how it busts the bone and comes out? How it manages to yes.
Due to the increased intraosseous pressure, and also
yes.
because of the increased osmolarity,
yes.
which causes the tissue breakdown,
yes.
thereby leading to a sinus formation with an opening over the skin, ma'am.
In this particular case, if you focus, this person had the history of knee plate for fracture 3 years ago. Why do you think this plate should be removed?
Yes, since he had a history of knee plate insertion,
yes.
I suspect the infection could be Staph aureus and consider knee plate a septic focus of infection.
Yes.
So if we do not remove this focus, then the infection will not subside, ma'am. So this focus should be removed.
Can you please tell me how the bone gets its blood supply?
The knee, ma'am?
The bone. Okay,
the bone.
Knee. All right, knee. How would knee get its blood supply? Which vessel supplies the knee?
It mainly receives the genicular branches from the popliteal arteries.
Okay. Then?
And from the anastomosis that is formed from the branches of popliteal artery, ma'am.
Yes.
And
but then how does it go inside or travels inside? How it forms the network, I can say, how it supplies the whole bone, whole knee. How the loop capillaries are formed, how the foci actually implants itself for osteomyelitis.
I'll get back to this, ma'am.
Okay. All right. Can you please tell me what is necrosis? The definition of necrosis, please.
Necrosis, it is a form of cell death in which the cellular enzymes, cell membranes fall apart and cellular enzymes finally digest the cell membrane.
Cell membrane, okay. What are the components of pus?
Pus, it contains mainly the dead microorganisms and then the dead neutrophils, ma'am.
Okay. All right. Okay. Can you please tell me, you told me, what is Workman's canal? Where is it located?
Workman canal, it is located in the cancellous part of the bone, ma'am.
Okay.
In between the I can't remember.
Okay. Tell me later. Can you tell me where growth plate is located in adults?
Growth plate is located in the metaphysis, ma'am.
I'm asking, I'm not telling. You have to tell me. Okay. Right. If a person, just suppose this patient has a sinus from the same spot because it has the right knee which is red and tender and swollen. Just suppose there is a sinus or there is something which or there is a wound which is not healing for more than 6 months, then what is the most likely or most highly suspicion that you will suspect?
If it is chronic and not healing, then firstly, I will suspect chronic osteomyelitis. And if the sinus, for the sinus, I will also suspect carcinoma, ma'am.
And give me complete answer. What type of carcinoma? Squamous cell carcinoma.
Squamous cell carcinoma.
Yes. Okay. What are the parts of the bone?
Bone, we have the
Epiphysis, then?
we have the epiphysis, metaphysis, and diaphysis.
Yes.
And we from outward to inward, we have the inner, we have the cancellous bone, and the outward, we have the spongy bone. And
Spongy, is it outside or inside?
spongy is inside, ma'am.
Yes. Right. Thank you.